Infections from intravenous drug use. What is intravenous drug use? Intravenous injections rapidly admit drugs into the body by way of inserting a needle into a peripheral vein in the arm or leg. Otherwise known as shooting, slamming, banging, blasting, or mainlining. Intravenous injections usually result in a much more rapid availability of the drug into the system. Intravenous injection also leads to a greater risk of dependency and infection from dirty needles or usage of toxic drugs. Why does for drug use produce infection? When it comes to for drug use and infection, there are many factors to consider. Bacterial infections are caused when germs on the skin, or within a contaminated needle, are pushed through the skin and deep into the body. Injecting a substance into the skin bypasses the usual barriers of entry that our body uses to protect us. If infection-causing bacteria reach blood vessels, it can result in infection of the widespread deep tissue, veins, or vascular tissue. Those who inject subcutaneously or engage in skin popping are at higher risk of developing infected blisters, subcutaneous abscesses, or pustules when users share needles or other injecting paraphernalia. Blood-borne infections like HIV and hepatitis C are common. Those who live in poor conditions and engage in intravenous drug use usually have a lack of hygiene and poor nutritional habits that contribute to the risk of getting other infections from shooting up, such as staph is the deadliest skin infection. With over 30 varieties, staph infection symptoms can range from mild to life-endangering. Commonly injected drugs. The most commonly injected drugs are heroin, amphetamines, barbiturates, buprenorphine, benzodiazepine, cocaine, and methamphetamine. Cause of bacterial infections: skin and soft tissue infections. Bacterial infections often arise from injecting a needle into fatty tissue beneath the surface layer of skin. Veins that leak during injection along with toxic drug usage can cause infection as well as tissue morbidity. The presence of bacteria on the skin surface while injecting can also result in bacterial infection. Types of bacterial infections: abscess, botulism, cellulitis, heart valve infection, HIV infection, AIDS, liver disease, tetanus. The spread of the HIV virus across China, Central Asia, and Eastern Europe closely corresponds with the rapid rise in intravenous or for drug use. Signs of infection. If an infection is present in bodily areas that are frequently injected, the injection site will become tender, warm to the touch, and red. A frequent pattern of injection causes infections that lead to discoloration, scarring. A person with swollen lymph glands that has a high fever and heavy sweats may need immediate medical attention. These needle infection symptoms are signs of an overdose or a toxic reaction to a substance. For example, black tar heroin is named after its tar-like consistency. It contains many additives and contaminants that can cause local infection, blood clots, and damage to the following organs: lungs, kidneys, brain, liver. Actor and more stars who died from fentanyl overdoses. Fentanyl has become one of the deadliest substances on the planet. The powerful narcotic, a synthetic opioid that's cheap to produce, is frequently mixed with recreational street drugs or prescription painkillers, creating a terrifyingly lethal combination that continues to claim more lives with each passing day. We're taking a look back at some of the bold-faced names we've lost to fentanyl over the years. Former child actor Adam Rich, who's best known for his work as Nicholas Bradford, the youngest son on the 70s and 80s ABC show 8 is Enough, died at his home in Los Angeles in January 2023. He was 54. 5 months later in June 2023, the Los Medical Examiner Coroner's Office confirmed that the star died from the effects of fentanyl and ruled his death accidental.